reschedule it, absolutely. Let me just make that change here. Okay, perfect. There we go. Okay, and it's still pertaining to the same issue you were having before. Okay, so just a follow-up. Gotcha. Excellent. Okay, I got you in our systems. And let me just make the correction. Let me just make the correction in my little notebook here, okay? Coming in, okay, on that May the 2nd, okay. Okay, and I'll just scratch it. The other one we have here for you, okay? Okay, perfect. So that is rescheduled for May the 2nd, and yes, for the follow-up. Okay, correct. Excellent. Alright, well, we will see you then. Alright, take care. Bye now. Hello, so sorry for the wait there. How are you doing today? Good, I'm glad to hear. And are you here for an appointment today? You are? Perfect. Okay, and can I just grab your time of your appointment? Perfect. And can I just have you sign in just on the sheet right in front of you there? Perfect. Thank you so much. Okay, let's see here. Oh, yes, I see. You are in for your cranial nerve exam today. Your extra long cranial nerve exam today. Fantastic. Okay. And I do have a note in my file here that we have not moved over your information to our digital side of things here. So we're just going to take a few minutes just to kind of get everything set up in there and make sure we have the correct information for you, okay? Excellent, that sounds great. Okay, so now from your name here. Okay, and I do have some of your information in my book already from our manual paperwork, okay? So I'm just going to take a few seconds just to type those out, okay? Fantastic. Okay, so we have your date of birth. And can I just get you to confirm, is this your date of birth right here? That is. Okay, perfect. Just to make sure we have all the correct information as well as the updated info. Okay. Okay. And next up. And you've been to this doctor's office before? Yes, after the relocation. Okay, so this would be your first time to this. Okay, that would explain that for sure. Let's see here. Filling out the form. We've got your name. We've got your date of birth there. We've got your date of birth here. Okay, and it looks like we do have this address for you here. Is that correct? No, it has changed since then. Okay. Would you be able to give me that correct information? Excellent. Thank you. Okay. Okay. Okay, in the city. Perfect. perfect. We've got that updated in both that address there. Okay, let's see. And I notice we have a little bit in your medical history there, but has there been anything else recently or within the past, since your last visit, that you need to update the file with? Yeah, absolutely. Yep, I'm just gonna type as you talk, okay? Sounds good. Okay. Okay, yeah. Absolutely. I can understand that. Okay, absolutely. Okay. Perfect. Let me just finish this note off here, right here, okay? Just make sure I'm typing this in correctly here, okay? Just make sure. Okay. Okay, and I'm just going to take a minute just to jot down the updates into our paper files as well, okay? Perfect. Where's that section here? Let's find that section. Okay. Oh, here it is. Here's the medical history section here. Okay, here we go. Let's go climbing fence. Okay. Also, when it comes to when climbing, so go around it. Okay. Perfect. Okay. So let me just see if any other information I need from you. Your name. Could I just grab your updated phone number as well? Okay. Okay. Oh, so extension numbers, okay. Okay, and then extension. Okay, and then another extension. Okay, perfect. That's the best and easiest way to get a hold of you. Okay. Can I just have you look over the long number just to make sure that I got it all correct? Yeah, just right on the screen, just right here. Oh, that's supposed to be a 3. Okay, and anything else? Oh, that's supposed to be a 9. Okay, supposed to be a 9. Oh, and that last number is supposed to just be... Okay, perfect. So that's the best way, and that's the correct number. Fantastic. Okay. So we will move on to see what else we need here. What else do we need? We have the medical history. Okay. Okay, now that we've got that all updated, I'm going to send that through, okay? slow so I can make sure I get it correct the first time. Okay, yes. One, okay. Perfect. And now I'm just going to really quickly just look under the number just to double check. 8, 5, 6, 7, 2, 6, 5, 4, 3, 2, 1, 0, 1, 0, 9, 8, 7, 6, 5, 4, 3, 2, 1, 1, 7, 8, 9, 10, 11, 2, 1, 2, 3, 42, 33, 3, 44, 99. Yes, that is the correct information now, okay? So we have everything all set for you there, okay? Now we have your information updated. Now we are just going to go to the next patient page here on my computer, okay? Okay, there you are. Perfect. Sometimes the new accounts take just a second to kind of upload into the system. There we are, and I'm going to double click on your account here. Yes, sometimes it takes a second or two to load, so please bear with me. Okay, here we go. Now we are going to just get into some information about the reason for your visit today, okay? Yes, you mentioned, or we saw on the account that it was for a cranial nerve exam. We just want to kind of go into any more detail as to why you specifically think you need a cranial nerve exam and the events that might have led up to these wonderments. Okay, perfect. Okay, so it was last Tuesday. Okay. And okay, so you found it in every cranial nerve area you could think of, or the nerve areas that you could think of. Okay, so you had issues with the optic nerve. Okay, so there was kind of an item that kept moving, but you felt it was challenging to follow along. Okay. Okay. And anything else with the optic nerve? Do you find that maybe lights are a little too bright sometimes, or you feel little twitches or twinges in the corner of your eyes, or anything to those effects at all? No, nothing like that, just the focusing part. Okay. Well, focusing can be linked to a lot of the things in the optic nerve. Okay. So yeah, I think we'll make sure that the doctor focuses on all areas, because, as I said, focus can kind of be linked to the light, as well as the response in your eye movements, as well as blurriness. That can all be linked within that. So I think we'll have the doctor go through everything in that particular nerve. Okay? You're okay with that? Sounds good. And that will consist of lights, as well as eye movements, as well as focusing on a moving object, as I'm sure you're aware. Okay, perfect. I'll just put that on the form here, okay? Okay. smell sensation. Do you find that that's been an issue at all for you, or you've had any moments? Okay, so you have had moments where it's been almost challenging for you to smell even some of the strongest scents. Okay, but it's also allergy season. Okay, so we'll keep that in mind, but we will definitely make sure that we do a detail just to make sure that it is not your nerves, in fact, okay? Perfect. Okay, so under the olfactory nerve here and smell detection, we will make sure that that is just allergies. Okay. Okay, perfect. So for the next one, it is the ocular motor nerve, the touch layer, as well as the abductrines. So when it comes to those are also eye related. So we'll kind of put those in with the optic nerve tests, okay? So those will all kind of relate within the same. So you'll go through the ones we discuss with the optic nerve, such as the eye chart, the light response, as well as movement with an object, and then we'll go into some other little more structured ones that maybe provide a layer of visuals, okay? And then we'll see if you're able to detect those as well. Yes, those are for 3 of the nerves: the ocular motor, the trochlear, as well as the abducens. Okay, perfect. So we'll do that combined with the optic nerves here. Okay. Okay. Yes, exactly. You're correct. That also ties in with pupil response. Perfect. You know your stuff. That's great. You've done a little bit of research. Oh, that's wonderful. It's always nice to have an idea of what you're going into. Okay. So the next category here on the form is the trigeminal nerve, okay? Now this one has a lot to do with touch sensation, clenching of the jaw, and trying to prevent me from moving your facial muscles. Okay. And have you noticed that you have any issues with that at all? Yeah, okay. I'm just kind of examining your face just to see if I can see any signs. Okay. Okay. So not really, but it's possible. Okay. Well, we'll definitely make sure we do tackle that one as well. Like I said at the beginning, we will go into a full broad spectrum of all of them. Even if it's not looking like not looking like there's nothing wrong with it, we're still going to make sure we do tests, because we're going into such details with some of the others. We might as well just do a complete overall and make sure that we know everything that's going on with your cranial nerves today. Fantastic. Okay. Now, along with that one, we also have the facial expression nerves, okay? So these ones, it's kind of like me preventing from moving your face again and move your head in different ways. But this one is more, you put on a smile and I try and turn it into a frown kind of deal, okay? So they're very similar in that sense. We'll also be doing the puff cheek test as well, where I try and push the air out of your mouth and you have to try and prevent it. And that all kind of ties into those with the trigeminal as well as the facial expressions. Okay, perfect. And do Smiling, frowning. No. Okay. Okay, good. We'll make sure to go over those just in case. Okay, let's see here. Now, the next one is going to be the vestibulocochlear, which is the hearing nerves, okay? Are you having any issues when it comes to hearing or trying to focus your hearing on a specific sound, such as a TV or music while other things are going on? Any difficulties there at all? A little bit of difficulty, okay. So that's something we should definitely be looking into. Gotcha. That's one of the main concerns for today. Perfect. Okay, so I'll make sure to put an importance on the vestibulocochlear nerve here. Okay, let's see. Yes, and you're essentially right for that one. It will be a lot of hearing tests telling me when a sound stops, telling me when a sound continues, telling me how many times a sound is made, all around those examples, okay? Fantastic. Okay, let's see here. The next category we have here, actually it's two of the nerves, and this one is the glossopharyngeal and vagus nerve. I always have a really hard time saying that first one, no matter how many times I practice. And that one will be the vagus is the gag reflex. So we're going to see how the back of your throat, your tongue, as well as your uvula, and see how all those are reacting, okay? And then when it comes to the glossopharyngeal, that one will be a palate evaluation. So again, it will involve the tongue. It will be different kinds of tastes, okay? We're going to see if you can detect different tastes ranging from sweet to sour to bitter, okay? Fantastic. And do you find you're having any issue with that in any area? Tasting, maybe. Okay, so it would provide you a little bit of comfort. Perfect. Okay, so make sure to do those here for the glossopharyngeal and vagus nerves. Okay, definitely for the gloss. Okay. Okay. So the next one we are looking at is the spinal accessory nerve, okay? Now this one with a lot to do how we were doing with the trigeminal head movements and preventing me. We're going to do bigger head movements with the neck as well as the shoulders, okay? And similarly, you just prevent me from being able to do that, okay? Okay, very good. And are you having any tension or neck pains that you're aware of? No specific problems there. Okay. So we'll definitely make sure that we tackle this one as well. So with the shoulders, I just put my arms on your shoulders and try and push them down, and you can try and push your shoulders up. Okay, so it's like a resistance kind of test. Okay. Yes, and same with the facial as well as the head movements. Perfect. Okay, let's see here. nerve that we will be specifically looking at today, and that will be the hypoglossal nerve, okay? So this one also has to do with the tongue as well, and I'll be detecting different movements, different patterns, seeing if it's able to it's able to go its full scope of everywhere in your mouth with no issues, as well as taking a quick look at the symmetry with your tongue to see if there's any issues pointing out with that we should be concerned of, okay? Okay. And have you seen anything specifically that would stand out to you for that specific nerve? No, not specifically. Okay, perfect. So we will make sure we do that last one here. The hypoglossal nerve here. And that is all the nerves. Okay, those are all the nerves in the upper region for the cranial area, okay? Fantastic. I know it seems like a lot, but it will go surprisingly fast because a lot of the tests are somewhat entertaining as well, okay? Fantastic. Have you ever had a full, very detailed cranial nerve exam before? Okay, so you've had somewhat of a detailed cranial nerve exam. Okay, good. So you'll know kind of an idea of what to expect. Have you ever heard of the other nerves before? Like the full list of all of the ones in the cranial? No, this is your first. Oh, okay. So this one might be even more detailed than you're used to. Oh, good. I'm glad you're excited for that. Okay, so it looks like the next appointment is just wrapping up, okay? So I am going to send through your file to the printer so we can put it on the clipboard for the doctor. Yes, you'll be dealing with Dr.Relaxa today. Oh, I know, he's wonderful, isn't he? Perfect. Okay, we've got that sent over, and I'm just going to add a note. The file that you have had experience with cranial nerve exams before, okay? Which is always wonderful, because then there won't be so much worry for you going into the appointment, especially because it is quite a lengthy appointment. Do you have anywhere to be after this at all? No, you made sure to have the whole day free. Okay, perfect. I'd say in total, on average, it's taken about 2 hours for an entire fully detailed cranial nerve exam like this. Yes, including the getting everything ready, so about 2 hours. Perfect. Okay. Well, if you will just have a seat, it looks like he is just saying goodbye to his patient right now, and he will be able to see you very shortly. Okay, very well. I will see you after. Take care. Okay. Hello there. You are my next patient, I imagine. Fantastic. Oh, yes, I see. I have you right here. Perfect. Okay. And so today you're in for a full, detailed cranial nerve exam. Like, extremely detailed. Okay, perfect. And I see a few issues here you've been having with some of your nerves, but it looks like the rest seem to be working normally, but we're just going to go through them all just for some peace of mind. Okay, perfect, excellent. Okay, so let's see here. We're going to start with, okay, olfactory. No, we'll be starting with the optic nerves, okay? And then we'll be moving on to the olfactory, the ocular motor, trochlear, trigeminal, okay. Vestibulocochlear, okay. Glass-phenole, and vagus, spinal accessory, okay. Perfect. It looks like we've got all of the cranial ones accounted for. I just wanted to make sure. Okay, we've got you here, and we've also, you were updated with your information with our new system. Yes, the receptionist got you in with that. Perfect. Okay. Okay. That is all go. Perfect. We'll just look over the last bit of paperwork here just to make sure everything is set before we jump into the cranial nerve, okay? So we've got this one here. We've got all information updated. Okay, perfect. That's what I'm looking for. We're just in the middle of updating our systems completely to digital, so we are making sure we cross our T's and dot our I's. Okay, there we go. And perfect, okay. So we're going to start off with the eye optic nerve tests, okay? So we're going to be going over, the receptionist went over a little bit with you. Okay, perfect. Just to go in a little bit more detail, for the optic nerve, we're going to be using the eye chart. We're going to be using lights to see how your eyes respond. We're going to be using my fingers. We're going to be using two color boards to mimic different kinds of shapes, letters and numbers as well, just so that we can have a better idea for how your eyes react in all different kinds of situations, especially when heavy amounts of color are introduced, okay? As well, we'll also be just looking for your pupil response and seeing how well you're focusing, which I see on here that is something that you've had issues with recently. Okay. Perfect. We'll definitely make sure to take a deeper look into those areas that you've been having specific issues with, okay? Perfect. Okay, so to start, I would just like to get a sign of how your heart as well as your breathing is doing, okay? So I'm just going to use my stethoscope here just to take a listen in. Okay. Here we go. Okay, so I'm just going to get you to take in a deep breath, okay? And then let it out gently, and then I will take a listen. Okay, perfect. Deep breath in. And let it out. Sounds good on that side. We're just going to try on this side as well. So same thing. I'm going to have you take a deep breath in and then exhale, okay? And in. And exhale. Perfect. And we're just going to do the same thing on this side, but just on your back now, okay? And I'd like you to do the exact same thing. Take a deep breath in and exhale, okay? And inhale. And exhale. Perfect. And we're just going to have a listen again on the back on the other side, okay? And take that deep breath in. And exhale. Oh, perfect. Perfect. Everything is sounding perfect with both your breathing as well as your heartbeat, okay? And are you experiencing any issues in those regards other than those sounding good? No? Okay, perfect. That's exactly what I like to hear. Okay, so I think now that we've got everything for the information in my little chart here, we've taken those here. I'm just going to make a quick note in my book here. Yeah, I'm not really a fan of charts and clipboards, so I just kind of transfer everything into a little book. It makes it a lot easier for myself. I call it my patient book. Okay, and your heartbeat was 1, 2, 3, 4, 7, 2, 2. And then when you're breathing, it sounded perfect and flowing, no obstruction in the airway whatsoever. So that is all sounding wonderful and a great start to this appointment here. Okay. And we will be doing full detail. Okay. And you don't have any immediate plans or anything after this? Okay. Very good, very good. Because it will be a bit of a lengthier one appointment today, okay? Good. I'm glad to hear. I'm very glad to hear. So we are going to first start off with jumping in to the optic nerve tests, okay? And we'll be going over with this optic nerve. We'll be doing the eye chart. We'll be doing some light response. We'll be doing some light patterns as well as just item movement patterns, just to see if you can clarify those with some smooth eye movement, as well as me examining your pupils just to see where they're at, okay? Okay. Perfect, sounds good. So we're going to first start with the light pen here, okay? Excellent, excellent. To start, we're just going to do a very basic movement, okay? And I just like you to follow it. Just focus on it and see where the issue is starting, okay? We'll pick it up at different speeds, but for right now, we're just going to go very, very slow, okay? Okay, very good, very good. Now, just follow it. Follow that light. And if you find that it goes out of your peripheral vision, just wait for it till you notice it coming back into your peripheral vision and seeing if you can get there as fast as you can, okay? And continue that focus. Perfect, perfect. Here we go. Very good. We're going to keep it at this speed for now because I know this is a bit of a issue area at the moment. Okay? You let me know if there's any issues. Very good, very good. So you're following it, okay? Everything seems to be in order, okay? Very good, very good. Okay, so I am just going to kick it up just a bit, okay? And you let me know if you're having issues. Perfect. I'm just going to be examining your eyes and your movements as well as your pupils, okay? Just follow it. Very good, very good, very good. That's right. Okay, you seem to be catching up with this pretty easily. That's good, okay? Especially when it comes out of your peripheral vision. Okay, very good, very good, very good. Very good. Very good, very good. Okay, and I'm going to pick it up just a little bit more, okay? Okay, I'm noticing you're having a bit more difficulty here, okay? That's okay, that's okay. Just try and keep up with it as best as you can, okay? Okay, I do see a bit of troubles there, okay? Okay, I think I see the issue here. Okay, so I think it's nothing serious, but I think just a slight eye stretch every morning for a week might help with that focusing. If you just do one and keep them there for just a few seconds, let them go, let them relax. Do the same thing for down. Few seconds, let them relax, and then vice versa on this side and up as well, okay? And I find if you're able to do that for a week straight, you may find that focusing will be a little bit easier for you, okay? Yeah, so we can make another appointment just to kind of see, touch base maybe in a week or two after you continuously doing that for, I'd say, the 7 days. Yeah, absolutely. Okay, perfect. So that should help with that for the most part, okay? And then that should also in turn help fix the focus. And if that does not help, in that next appointment, we'll be able to look at that and give you a better solution, okay? Something more fitting to the knowledge that we've gathered from here. Okay, very well. Perfect. So I think we're gonna, because we have the light here, we are just gonna jump into the color light ones, okay? Okay, so we'll be using, like I said, the colorful papers here, okay? We're gonna first be using this one. It is a brighter color, so it will be a little bit more easier to detect, okay? So with this one, I'm going to be forming a letter, a number, a symbol, something for you to tell me what it is, okay? And then from there on, we'll be able to see if you're able to focus on the pattern enough to be able to tell me what the symbol is, okay? Yes, exactly. Yep, just like this, I'll demonstrate. Just like so, okay? So I just want you to take a really good look at the symbol. I'll draw it probably about 3 times, okay? And then you can tell me the symbol from which one it is, okay? Okay, perfect. We're gonna start with just a very easy one just to see how everything's going, okay? Yes, very good, very good. Okay, so it does appear that you are able to see it for sure, no problem, okay? Yes, that is correct. Good job, okay. Now how about this one here? Yes, you are correct. You are correct. You are correct. Hashtag. Good job. Okay. Now, what about this one right here? What about this one right here? Okay. And make sure you wait to the end before you see everything, because symbols, letters, and numbers can be construed as each other if seen before they are finished. Okay. So let's start with this one here. Okay. Okay. Yes. Good. Yes, very good, very good. You got that one correct. Yes, you see what I mean, right? Okay. Perfect. Now let's start with this one. Okay, very good, very good, very good. And what about this one here? Yes, yes, very good, very good, very good, very good. Okay. So let's start. Yes, very good, very good, okay. Yes, I didn't stop you there. That is the infinity symbol, even though it is an 8 just on its side, okay. And what about very good call. You can't tell if I'm doing a 0 or an O. A 0 or an O. Oh, I've got an idea to differentiate them. Now you tell me which one this one is between those two, okay? A 0 or an O. That is correct. That is a 0, a 0, a 0, 0, 0, 0, 0, 0, 0, okay? And then this one will be an O, 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 an O. Perfect, 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 perfect. Okay. So it seems with the brighter neon color with the light, you have a pretty good handle on that. Now, did you find that there was any trouble when it came to focusing on those symbols, numbers, and letters? No. Okay, okay. So your light response seems to be very good and very a little different than the actual movement and focusing on a moving object, okay? That gives us a little bit more insight here, okay? Okay, and next we're going to be using this much smaller card here, okay? And we'll be doing the same thing, but they will be much smaller designs of the symbols, letters, and numbers, okay? Okay, are you ready? Okay, perfect. That is correct, yes, yes. Good job, good job. And what about right here? Yes, yes, very good, very good. And what about this one right here? Yes, yes, you are correct. That is correct. Good job, good job, good job. Okay, now tell me this one, okay? Yes, yes, you were paying attention in the last round. That is correct. An O, an O. Good job. Now tell me about this one, okay? Yes, yes, very good, very good, very good. Now, the very last symbol, okay? Are you ready? Okay, perfect. Yes, this one is challenging. Try and... You are correct, Dr.Relaxa. Me. Very good. Okay, and now we will be doing... I will be using this instrument here, and we're doing something similar to the light, but instead of using light to make these symbols, letters, and numbers, we will be using this instrument here, which we'll be using later as well for the eye chart, okay? And now, I just want you to tell me the shapes, numbers, and letters that I am drawing in the air, okay? And I just want you to tell me exactly what symbol, letter, or number you are hearing, okay? Or seeing, not hearing. Alright, perfect. Let's get started, okay? Yes, very good. And what about this one here, okay? Yes, very good, very good. And for the last one with the light, I'll be doing 3, maybe even 4 times of drawing out the symbol, letter, or number, okay? Perfect. Here we go again. Yes, correct. You are correct. What about now? Very good, very good. And what about now? Very good, very good. And what about now? Very good, very good, very good. And what about this symbol? I'll give you a hint, okay? This symbol. Okay. Yes, very good, very good, very good. What about this symbol here? Yes, very good, very good. Very good. A stop sign. Hexagon, 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 hexagon. Okay, and what about this symbol here? Yes, correct. A lowercase m. Good catch on the lowercase, lowercase. And what is this? Correct, correct. That is the right number. Now, what about this? Yes, that is correct. That is correct. That is the correct number right there. Good job, good job, good job. So I notice that you're not having any difficulty with following those. Now, what if I were to pick up the speed a bit? Do you think that would make it a little bit more difficult for you? Just to see if there's any areas in this particular nerve with this test that we can maybe get a little bit more detail in to help you along the way. Yeah, okay, so I'll do about 3 or 4 more examples, okay? And I'm gonna pick up the speed a bit, okay? Okay, excellent. And here we go. Yes, very good, very good. Okay. And what about this one now? Yes, yes, very good, very good. That is correct as well. Okay. What about this symbol here? Yes, that is correct. It is a cylinder. You are correct. You are correct. You are correct. Okay, what about this very last one? Okay. You are correct. That is a star. That is a star. Good job. Good job. Good job. You got that one correct. Excellent. So that means that there isn't a whole lot of issue when it comes to that kind of focusing but it seems like when light's involved and there's a lot of movement at a higher rate, it does. That's what you've noticed too, okay. And when you had this situation from before, was it more what you were like watching TV, playing a video game, or maybe at a sporting event or some kind of event with a lot of lights? Yes, okay, so you were watching TV and you were having troubles following the brighter symbol that's on the screen. Okay. I'm convinced that the stretches that I told you about earlier will come in handy for that, okay? Okay, perfect. Alright, so let's jump into the next part, which will just be the eye chart, okay? So I'm going to grab just the chart right here. Here it is, right here. Okay, and normally I do put it on the back wall, but I feel like with the whole focusing thing, I would like to get a closer view up close, because it doesn't seem like you have trouble seeing far distances. It's more the movement along with the light, okay? So I'm going to bring the chart up right close, okay, right to here. And I'd just like you to tell me which letter, number, or color I am pointing to, okay? You are correct, okay? So let's go down to this second line here. Okay, very good. And this one? Very good, very good. And can you tell me what this color is right here? Yes, very good, very good. And what about this color right here? Yes, you are correct. That is blue. And are you able to make out what this number is right here? 1, you are correct. Okay, perfect. We're off to a great start. So let's move on to this third line here. So this will be our 2070 view. So let's see if you are having any challenges with this line here. Correct. And what about this one here? That is correct. Good job. And what about this one right here? Yes, you are correct. That is a Z or Z, whichever. And we have which number here? Very good. And which number again? If I did this one before. Very good, very good. Okay, and we're just going to go down to this 20 over 50, okay? 20 by 50. So let's do, or I guess 2050 would be the way you say that. So we've got the L here, and we've got the P. No, I'm not telling you the letters. Oh, my apologies. Yes, okay. And then this one. Yes. And what about this one here? You are correct. And what about this one right here? Yes, that is correct. And what is this number just right over here? It's just right over here. That is correct. That is a 4. And that'll bring us down to the next one, 2040. Okay, so we're going to start with this one right here. P, yes, good job. And what about this one here? E, yes, good job, good job, good job. And what about this next one right here? This, yes, this C, good job. And then this one, oh, as well. The F, yes, that is correct. That is an F. And what about this one right here? D, yes. And finally, this last number. A5, yes, perfect. And can you tell me what this color is right here? Yes, you are correct. Good job. Okay. So let's move right down to the 2030. Okay, and you can tell me what this letter is right here. Yes, good job. And this one right here. Yes, that is correct. This one right here. Perfect. This one right here. Excellent. What about this one right here? That is correct. And what about this last one right here? Perfect. And this last number right just at the end here. You are correct. Yes, good job. Alright, so now we are moving up. And we're going to start right at the 20, 25. And can you tell me what this letter is right here, okay? That is correct. Good job. And what about this one? Very good. And this one right here. Very good. This one. Excellent. This one right here. This one. And the last letter right here. Very good. And what is this number right here? You are correct. Yes, you are very correct. So I'm just going to fold this up just a bit more. Just like so. And now this brings us down to the 20 by 20, okay? So this will tell us if you have 20 by 20 vision, okay? So if you can just start here, and this will tell if you have 20/20 vision, okay? So we're just gonna start just at the top here, and tell me what this letter is here. Very good, and this one. Correct. This one. Yes, very good. And what about this one here? Excellent. And this one right here. Very good, very good. And this one. Perfect. And what about this one right here? Perfect. And this last letter in the 20/20. That is correct. So you definitely have 20/20 vision, okay? At the very least, we're not done with the test yet. Can you tell me what this number is here? You are correct. Yes, good job, good job. And can you tell me what this color is right here? Yes, you are correct. Good job, good job. Okay, now we are at the 2015 row, okay? So I would just like you to tell me, and if you can't, that's totally okay. But tell me what this letter is right here. Yes, that is correct. Good job. And let's keep it going. Very good. That is correct. That is correct. What about this one right here? Very good, very good. And this one, this one. Excellent. And this one right here, this one. Perfect. This one. Yes, and what about this one? That is correct. You got the entire line right. And can you tell me what this number is? Yes, you are correct. Alright, let's see if we can go for 2013, okay? 2013 eyesight. And with this one on this side right here. That is correct. Good job. And this one right here. Correct. This one. They're getting a little bit tougher now. Yeah. But that is right. Yes. Good job. This one. Yes. Very good. Very good. And this one. Yes, that is correct. And what about this one right here? That is right. Yes. This one. That is correct. And this last one in the line. You are correct. You have at least 2013 vision, which is impeccable. And this 10 here. I just told you the number, didn't I? Well, if you're able to see these, you can definitely see this big number, so that's okay. And let's see if you can do the last 2010 line, okay? Let's try this out. Yes, correct. And this one. Yes, you are correct. Take your time. No need to rush at all. Yes, correct. Good job. And what about this one right here? Yes, that is correct. Good job. And this one right here. correct. Okay, and this one. Very good, very good. And this one. Yep, let's finish off strong. What about this last two? Second last one. Yes, you are correct. And this very last one. Yes, you are right. And these numbers. Good job. You have 20/10 vision, which is incredible. That is so wonderful, and I'm so glad to see it. This gives me extreme confidence that we won't have to worry after that week of eye stretching. I have the feeling, and from what I'm seeing, you are going to come back in after that week, and everything will be in focus, and you'll be able to, well, everything is in focus for you, but you'll be able to focus even on faster items, even if it is light, okay? Yes, exactly. So you won't have any issues with watching television or anything like that. Okay, perfect. Okay. Well, we have gotten through all of the optic nerve tests. We've gotten through all of the ocular motor, the Chauchelier, as well as the abducens, and we also were able to make sure that the smooth eye movement was proper, as well as the pupil response, okay? And now that we have some kind of a plan for that one, I think that nerve is going to be perfect after that week. Fantastic. So let's just jump right into the next set of nerves, okay? Perfect. So the next one we are going to be moving on to is the olfactory nerve, okay? So the smell nerve. And I have 6 different scent cards here, okay? Each ranging from subtle, fruity to a bit more robust smells, okay? So these will cover all, pretty much the different kinds of arrays of smells out there, okay? All from sweet, pungent to savory, mouth-watering, all that kind of stuff, okay? But I don't want to give you too many hints. Alright, so let's get started. So these are a scratch and sniff card, okay? So we're going to be starting, and don't worry, even though some of them might have interesting names, they aren't anything revolting or anything like that, okay? This is more for just to get a sense of where your scents are at and which ones you can pick up on. Okay, perfect. And I noticed in the notes there wasn't a huge concern with this one, but there was a little bit concern with the taste. So because taste and smell can be somewhat associated at times, this we do want to make sure we focus specifically on. Yes, just in case there is something wrong with the other one, they might be linked in that way, okay? So we're going to make sure that we do this one extra well, okay? And make sure where you are with this. Sounds good. Okay, so we are going to start with the first card here. Pick one at random. Now they do require a bit of a scratch, okay? This one is scratched enough, and if I can just get you to gently smell the scent and tell me what it is, okay? correct. It is, well, the picture is of a horse and a swordsman, but it is a barnyard farm kind of smell. You are right, in kind of like that pungent, masking odor, okay? Yeah, it's not, it just, the names are just exactly what the cards show, essentially, but they aren't necessarily unpleasant. But you were able to smell that one, so that is good, because that one is a bit of the easier ones. So as we go towards the end of these smell tests, it will get a little bit more challenging, okay? Just so that we can really put your smell nerves to the test, okay? Absolutely. Okay, let's grab this next one here. And again, we will give it a little bit of a scratch, okay? Okay, and if you can just give this one a sniff. Perfect, and if you can tell me what that scent is, or just a general idea of what the scent is. You are correct, yes. It is a fruitier cologne style. I believe it is unisex, but yes. Even for the swordsman on the go. Alright, and we are going to move into the next one here. Okay, here is the third one here, okay? And again, we will have to give it a little bit of a scratch, okay? Scent a smell. Very good, very good. And can you tell me what that scent is? You are correct. Yes, it's more of a florally perfume, and I believe it is also unisex as well. And yes, that is a more subtler than that fruit, but you still detected it. Good, very good, very good. So now, just like the last one, it will get a little bit more challenging here, okay? So feel free to give it a little bit of thought before giving your answer, or maybe even smelling it twice, okay? Alright, perfect. Okay, and we have this one here. Okay, and you'll just give this one a smell, and don't be alarmed if you're not able to get this one, okay? Give it a smell there. Very good, very good. And just kind of take it in. And just give it another sniff here. Yeah, this one is really tough, so. A robot's bathwater. Yes, that is exactly it. That is impeccable. I don't know how you got that one, but and that was the most randomly named one we have, and you managed to get the exact word. That is outstanding. Remarkable, remarkable. If you got that one, I would be shocked if you didn't get these next two. Okay, so let's just jump right into it, okay? And as always, they need a little bit of a scratch, okay? Just give this one a smell here. Okay, very good. Take it in. And give it this one another sniff there. And can you guess what this one is? Very close, yes. It's titled Bird's Nest. So, yeah, a bird. Or birds, or birdcage that would definitely work as the answer as well. So, wow, I'm impressed with your olfactory sense. And now we have the last one here, okay? The very last one. Now, mind you, you've already done the toughest one, but I still think this one provides a bit of a stump, okay? Okay, perfect. And here we go with the very last one and the little scratch. This last scent card a sniff. Very good. Give it a little bit of a thought. Okay, and add one more smell. Okay, and can you tell me what that scent is? I'll take that as a correct yes. So it's a goblin swamp, but swamp or mossy area is pretty much the general area and the right answer as well. So very good. your olfactory nerve is on point. It doesn't seem to be getting affected anything by the taste issues that you've been having, so that's a really great sign for the actual taste test itself. Yeah, absolutely. Okay, well, we will just dive right into the next one, okay? So let's see what I have listed next here. Olfactory, optic nerve, ocular motor, potentially. I think we are going to move into the trigeminal nerves, okay? Which is a lot of the touch sensation on the forehead, the jaw, the neck, and the shoulders, and the movements I was talking about earlier. Okay, perfect. Okay, so for this section, we're going to be covering the trigeminal nerve, we're going to be covering the facial expressions and their nerves, as well as the spinal accessory, okay? So those all have to do with preventing your face, your shoulders, your neck from doing movements in specific ways, so that we can see if there's any pain, any resistance, or anything that's maybe a little bit weaker than it should be. Then we'll be able to take a look into those and again come up with ideas and exercises that can strengthen those if need be. Okay, perfect. So I think we're going to start with just basic facial expressions, okay? I'm just going to get you to do facial smiling, frown, shocked, okay? And now, once we have an idea for that, I'll be able to try and force your face into different expressions, okay? And to see how your elasticity as well as your restraint is, okay? Okay, perfect. So just smile, frown, shocked face. Okay, perfect. So there's no issues with any of those. So I'm just going to get you to do the smile again, okay? And I'm going to try and pull the smile down. I'm going to try and pull the smile down, okay? We're going to try and pull this down. Okay, perfect. Can't do that. Now I want you to do a frown, and I'm going to do the same thing. Try and make it a smile, okay? Frown for me. Perfect. And we're just going to do the smile. Try and make it a smile from a frown, Okay, very good. And now your shocked face, okay? And I'm going to try and just close around your mouth here. No, you're preventing me. Good job. Okay, and now I'm going to get you to fill your cheeks with air like that, and I'm just going to try and push out that air from your cheeks, okay? Okay, here we go. Perfect, just like that. Okay, good. Don't let me push out the cheeks. Don't let me push out the air from your cheeks there. Okay, very good. Okay, so it seems everything there seems perfect. The resistance is exactly what we're looking for, okay? So now we're just going to quickly move on to, actually before we do that, one more in this area. I'm just going to get you to close your eyes, and I'm going to try and open them, okay? So I'm just going to have you close your eyes for me. Okay, close your eyes. And I'm going to try and pull them open and try and open them. Okay, I'm going to try and open these eyes. Okay, very good. Opening, trying to open. Good, you're preventing me. Good job. Okay, you can open your eyes. And now we are just going to move right into the touch sensation, okay? So I'm going to be poking you on your forehead, on your cheeks, on your chin, your nose, and I'd just like for you to tell me where I am poking you, okay? Okay, perfect. Okay, I'm going to poke just right here, and where do you feel that? You feel that on your forehead? Okay, perfect. And what about right here? You do? You feel that on your cheeks? Okay, perfect. And just right here. Perfect. You do feel that on your chin? Okay, excellent. Very good. And what about right here? Yes, that is correct. That is your nose, right on your nose there. Perfect. Okay, and what about right here? Very good. Yes, just on your shoulder there. Okay. So it seems like you have the sensations, and you all the sensations are working properly, and you can feel them from where they're being touched, okay? So along with that, in the trigeminal ones, clench your jaw. And then I'm going to try and just move, okay, in certain ways and see if maybe there's something that shouldn't be moving properly, okay? So just clench your jaw for me. Just clench that jaw, clench that jaw. Okay, and I'm just gonna just right here, just touch right on the sides here. See, and we're gonna try and unclench. No, you're preventing me. Very good, very good. And now you can relax your jaw. And now I'm going to be just slightly moving your head in different directions. But I don't want you to let me, okay? I want you to restrain and put the restraints on it and not allow me to do that, okay? So we're just going to turn your head this way here. Very good, very good. Don't let me. Very good job. And just again on this side. Don't let me. Okay, there's a little resistance, but that's okay. That's normal. And we're going to go just again with this one right here. Don't let me. Very good, very good. And then again, just at this back here. Don't let me. Very good, very good, very good. There we go. You prevented me from being able to lift those, and that is perfect. That's exactly what we're looking for, okay? So now that we've got that closed eyes resistance, we are going to be just moving on to the shoulders, okay? We're going to move on to the shoulders, and I'm going to try and, just like the other examples, try and push down your shoulders, okay? And I want you just to keep them up. Even try and push them up even higher against my hands, okay? Okay, perfect. Alright, are you ready? Okay, and try and prevent me from pushing your shoulders. Very good, very good. Oh, that's very good. You're preventing me. Very good, very good. Yeah, perfect, perfect, perfect. Keep doing that. Keep preventing me. Keep doing it. See how long you were able to do it for. See how long you were able to do it for. Okay, very good, very good, very good. Perfect, excellent, very good job. It seems like your shoulders have very good resistance strength in that regard, as well as your facial muscles and your neck, okay? So everything's looking good with the trigeminal, the facial expressions, and the spinal accessory, okay? Perfect, very good, very good. So I think we're ready to move on to the next section, okay? And that one will be we'll be diving right in to the glossopharyngeal nerve, which will be the taste tests, okay? As well as the tongue examination. Perfect, okay. Well, let's jump into it. Okay, so before we jump in to the taste testing, okay, we're just going to quickly get through the vagus nerve as well as the hypoglossal nerve, okay? So I'm just going to be checking out the tongue, the symmetry, as well as just looking at its basic movements and using the tongue depressor for a gag reflex, okay? Okay, perfect, excellent. Okay, so I'm sure you've done this before, but I'm just gonna have you open your mouth and say, ah. Very good, very good. And I'll just have you open your mouth and just move your tongue from side to side, up and down, maybe even a circular motion, okay, just so I can see what the movements are like with the tongue, okay? Okay, very good. Very good, very good. No abnormalities. No abnormalities at all, okay? Perfect. Okay, and just do kind of a basic, just a round call. Perfect, okay. And now can you stick your tongue out as far as you can for me? Okay, perfect. Perfect. Okay, excellent, excellent. Okay. Now, did you experience any pain when you tried to push it out as far as you could? No? Okay, perfect. Perfect. That's exactly what we're looking for. So, everything looks perfect with your tongue, as well as your gag reflex. Okay, so now that we've gotten that stuff out of the way, we can get into the better tasting stuff, okay? For the taste test. Yes, absolutely. So there will be eight flavors in total. There will be 2 containers, okay? 2 containers. And we will be going from one style container to the next, okay? And so that means four flavors will be in this little jar here, and 4 other ones will be in a bottle, just very much like this, okay? With a liquid scent in it, okay? The spray bottles have more of a lighter, easier to spray flavor, and the droplets have a more thicker, more robust taste to it, okay? Okay, perfect. Well, let's just jump right into that, okay? Okay, first we're going to start with this one right here, okay? And we're just going to give it a quick mix. Now, these are 8 cents, okay? And none of them, in any way, shape, or form, are gross tasting or nasty in any way, shape, or form, okay? It's just to go over all the different types of tastes there are, okay? Like sweet, sour, savory, umami, etc., okay? Perfect. Okay, now this first one here, I can't give you any hints or anything like that, okay? Okay, so here we're going to get just a couple droplets. Now what I'm going to do is I'm going to put this above your tongue here, okay? And I'm going to drop a few droplets like so. I'm going to do about 5, okay? So you get a really good taste for it, okay? Alright, sounds good. And here we are. And 1, 2, 3, 4, 5, and 6. And give that a taste. Give that a taste. And can you tell me what that tastes like? Yes, you are correct. It is mangoes. It is mango flavor. Excellent job. And we will move on to the next one here, okay? I'm just going to give it a proper little shake here. Proper little shake. Okay, perfect. And now with this one, it's going to be very similar. I'm going to get you to stick out your tongue, and I'm just going to spritz a few sprays onto your tongue, probably about 4 or 5 again, okay? Actually, probably about 2 or 3, just because it does cover a larger volume of area. Alright, perfect. Just gonna make sure this works properly. Excellent. And if you'll just stick out your tongue. And can you tell me what that tastes like? Yes, you are correct. That one is strawberries. Correct. Very correct. Okay, let's move on to, let's see here, let's choose a little bit more challenging of this one, okay? Okay, let's do this here, let's try this one. And I'm always going to keep the answered label on this side away from you. Okay, here we go, we're just going to give it a nice little stir up here. Very good, very good. Okay, and same as before, stick out your tongue for me, please. Excellent, very nice, very good. Here we go. And in 1, 2, 3, 4, 5. And can you tell me what that flavor is? You are correct, yes, it is vanilla bean. It is vanilla bean. Now that one is slightly less flavorful than the last one, and as you'll notice as we go through 2 sets, one of the bottled and one of the see-through bottle, it will get more and more challenging, okay? Okay, perfect. So now we've got this one here. Slightly more challenging. Okay. Okay, perfect. And if you will just stick out your tongue. Okay, perfect. And one spray to make sure it works. Perfect. And 1, 2, 3, 4. And can you tell me what that tastes like? Yes, cinnamon, you are correct. Yes, very light cinnamon. Good job. Okay. Let's dive right into the next set here. Now remember, these ones will be a little bit more challenging for you, okay? Let's try this one. Maybe we'll go with, okay, we're gonna go with this one here. Okay, we're gonna give it a good stir. Perfect, okay. We are going to do the same thing. Stick out your tongue there. Perfect. And here we go. 1, 2, 3, 4, 5. And why not 6? Perfect. And if you can tell me what that flavor is. Yes, you are correct. That is correct. That one is more of our tougher challenges there. And I'm surprised you got cheddar cheese. That's very impressive. Now, along the way, have you found any trouble or difficulty with any of the tastes so far? No? Okay, good. Yeah, I'm starting to think that maybe that was just a fluke. Maybe it was just a bit of a cold that resonated and didn't settle, and it just affected your taste buds. Something to that effect, you know. Perfect, good. I'm glad to hear. Well, at least I'm glad to hear you're feeling better now. And that it may not be the case. Let's do this one here. Okay, perfect. Give it a good shake up here. Give it a good shake up. Okay, perfect. And I'll just get you to stick out your tongue. Do 1 squirt to make sure it works. Perfect. And 1, 2, 3, and 4. And can you tell me what that tastes like? That is correct and incredible. just like the last one. This one was quite a bit more challenging. It was deli meats, and you got that one too. Very good. I'm very impressed. And also relieved to see that one of the nerves is working perfectly fine as well. Okay, we are down to the last set, okay? The last set of tastes. Okay, and we'll just grab this one right here, okay? Right here, and we'll give it a good stir here. Okay, are you ready? Okay, make sure I get enough of this one. This one is running out. I'm gonna have to put it on its side here to try and get. Oh, there we go. I got a bit right there. Wipe off the excess here. Okay, perfect. And if you'll just stick out your tongue. Perfect. And I'm going to do a few more drops just because this one will be a little bit more challenging to get, okay? Okay, perfect. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, can you tell me what that flavor is? And feel free to take your time, okay? Absolutely feel free to take your time with this one. That is correct. Chocolate milk, you are correct. Yes, a very light chocolate milk. I'm blown away. Yes, they have all had a theme, I'm sure you've noticed. So it'll give you a bit of a hint for the next one. Okay, let's see. Let's do this one. I think we're gonna go with this one here, okay? Give it a good shake up here, okay? By tapping the sides, it helps get the flavor working. Okay, perfect. Now, maybe do, as we always do, a little quick testing spray here. And for the final test, the taste test, stick out your tongue, please. Perfect. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, take your time, and can you tell me what that flavor is? rest, and you also got the scents as well. Very, very, very well done. And I'm very glad to say that your taste test, your tasting nerve, sorry, your glossopharyngeology, this one is challenging for me to say every single time. We'll just call it the gloss. Your gloss nerve. Your gloss nerve is perfect, okay? So there are no issues with that one at all. So far it is just the bit of focus that we had with your optic nerve there, okay? Yes, absolutely. We will move on to the last one, which is the vestibulocochlear nerve, okay? And that is the hearing tests. Yes, we are nearing the end. This one is on the shorter side compared to some of the other tests. Okay, perfect. Let's dive right in so we can get you out of here. Okay, so we are going to be using 3 different items, okay? And I am going to be getting you to just to tell me exactly when those items stop making sound, okay? Perfect. Okay, so the first item up, some of them are a little goofy, mind you. This little banana here. It is full of sand, as you can hear. Here, I'll put it up next to your ear here. Right? There's a little bit of sand in. And then we've got this little goop tube, as it's called. It's good for using in visual nerve exams, but also that's kind of sticky breakthrough sound of all the glitter hitting the little notch here. Makes for a perfect sound for this test. And then finally, we will be using just a simple water bottle and tapping on the top. Okay? So for this one, there'll be 2 different tests. We'll be using each individual item, and I'll have you tell me when the sound stops. Okay? Simple. And then the next test, I am going to have you tell me which noise or which item is being used to make the noise, okay? Okay, perfect. Let's jump right in, and actually, let's start right with this one here. Now, I'm going to let you know what this sounds like. Okay, and I would just like you to tell me when that sound stops, alright? Are you ready? Okay, perfect. Here we go. Yes, very good, very good. And we're going to go on this side, and same thing, okay? Excellent, very good, very good, very good. Now we will be just moving on to the banana, okay? And now just in this ear here. Tell me when the sound stops. good, very good. And now, same thing on this side, okay? Yes, very good, very good. And the last one here. And just in this ear here first, okay? Tell me when the sound stops. Yes, very good, very good. And now just on this side as well. Yes, very good, very good. Okay, perfect. So you were able to detect when each of those item sounds stopped, okay? So that is fantastic. That's exactly what we want to see with your vestibulocular nerve, okay? Excellent. And we will just move on to the next test, okay? Okay, so in this test, I just want you to tell me which item it is, okay? You should know them pretty well now from just hearing them repeatedly, okay? You got this? Okay, perfect. Tell me which noise this is. Yes, the banana, you are correct. Now, tell me which noise this is. Yes, very good. The tapping of the water bottle. Now tell me what about this one. Yes, you are correct. The banana again. And what about this one? Yes, yes, very good, very good. The goop tube, you are correct. And what about this one? The water bottle, you are correct. Okay, what about this one here? Yes, you are correct. Okay. And what about this one? The banana. Yes, you are correct. What about this one? Yes, the water bottle. Good job. What about this one? You are correct. back to the goop tube so you are able to determine all of the sounds there, okay, with no problem whatsoever. So that is everything for our appointment today for the full detailed cranial nerve exam, okay? We have gone through all of them and everything looked fantastic except for just that little bit of focus in the optic nerve, okay? So if you just do those exercises as I showed you, going to each side for a few seconds for 7 days, okay? And we will have an appointment booked back for you, okay? Check in to see how it's doing. And you feel good about all this? You're doing well? Good, I am glad to hear. Well, I hope you have an amazing rest of your day, and I will see you at your next appointment, okay? Absolutely. Stay safe.